we also have to think about having selection criteria, and these selection criteria are based on the competencies, but they're also based on some other novel parameters, if you like, and they relate to selecting for societal needs, okay? So I thought we'd spend the rest of this sort of session, my talk, just discussing what you feel are societal needs and what you feel is required as individuals to actually succeed in surgical training. Okay? Because this is certainly where all of the vocational training programs, whether you do surgery, whether you do anaesthetics, intensive care, medicine, even pathology, they're all heading in this direction. So it's important that you have some awareness of that. Yes, we do have accreditation standards, and selection into surgery is highly regulated now. It's highly standardised, there's a lot of accountability. So the old tap in the shoulder and a couple of corridor conversations amongst a couple of consultants is certainly not guaranteed to get anyone into surgical training. Quite different to, again, when you and I went through. Okay. So, I'd just like some suggestions from you, some thoughts that you have about what do you think society needs of surgeons and of surgical practice, or a service of surgical care? Anybody? Josh?
Some engagement or internal motivation of the surgeons to engage with the community.
Yep.
And the needs of the community which they're practicing within.
Yep. So can we expand on this? What are the needs of the society or the community?
Well, I think some form of representation of, say, like the different demographics of that community.
Yeah.
That would help, like, form that doctor-patient relationship or the surgeon-patient relationship.
Yeah.
Maybe bridge some of the needs.
Yeah.
A bit more like sort of directed.
Yeah. So we're really talking about surgeons or the community of surgeons being diverse enough to represent accurately or closely represent the communities they serve. So why is that important?
Something like that, where people in the surgical community understand nuances of different cultures.
Yep, yep. Yeah, so all of that, you know, and I don't want to downplay cultural safety. I mean, I acknowledge that there's a lot of jargon now, but when you look past that, it's actually important because, again, the evidence would suggest that if you have a group of doctors who do not identify with a particular community culturally in their values, then that particular group of community have poorer health outcomes. And actually, it doesn't matter whether it's surgery or not. But it can be amplified specifically with surgery, because one of the other problems that we have in surgery is a lack of distribution of surgeons equitably across our societies and our regions, okay? So yes, so one of the key things that society needs and communities need are people who come from their communities. And, you know, we all know Australia's a pretty diverse, culturally diverse place. Many of us are immigrants. Many of us have immigrant heritage and families. And those cultures with those differences actually impact on health outcomes. And so patients are reluctant to go and see a doctor of a particular gender or particular ethnic group because they have different expectations, and so for that simple reason you get different outcomes. And of course a lot of surgeons, all of us in fact, have our inherent biases. So we have, you know, we approach different patients in slightly different ways, and sometimes we don't know it, sometimes we're sort of aware of it, but we sort of push it down in the back of our consciousness, and really that actually also has an impact on the quality of care that we can give. And again, that impacts directly on the outcome of that patient.